So, for my final project, I will be talking about healthcare systems, infectious diseases, and women and children's health. More specifically, I'll be talking about what is a healthcare system, what are the four types of models, and the Affordable Care Act. And then for infectious diseases, I'll be talking about our disease presentations from the fall. And then for women and children's health, I will be talking about our women's health presentations from this last spring. My first topic is infectious diseases. So we did our infectious disease presentations. Mine was on the plague, but many other people did theirs on diseases that are more common today, like pneumonia, influenza, meningitis, encephalitis, HIV/AIDS, and tuberculosis. We took notes on all the presentations and got to learn about the cause, transmission, symptoms, who's at risk, the diagnosis, the treatment, prevention, where in the world it occurred and how many people it affected, and if they are trying to eradicate and how they are trying to do that. It is important for everyone around the world to have some education on common diseases so that they know what to do if they or a loved one is diagnosed with one. If education and awareness is spread throughout the world, more people would take the precautions and get a vaccination or try and prevent the disease from happening in the first place. It is important for me as a potential healthcare worker to know the details of common diseases in order to keep myself safe while handling patients with the disease, and so that I know the treatment options to give my patients the best and most efficient care I can. My second topic is healthcare systems. During our healthcare system unit, I got to learn that a healthcare system is an organization of people, institutions, and resources that deliver healthcare services to meet the health needs of a target population. There are four types. The first is the beverage bottle, which provides public providers and hospitals for all citizens with services financed by the government through tax payments. The second one is the Bismarck model, which covers healthcare costs at private providers and hospitals through payroll deductions financed by employers and employees using private providers. And the third one is the National Health Insurance, which covers healthcare costs at private providers and hospitals through a public insurance system funded by premiums or taxes. The fourth and final one is out of pocket, which is health care services provided based upon the ability to pay out of pocket, which basically means no money equals no health care. The United States is a mixture of all four. It's an employer sponsored insurance, which falls under the Bismarck model, Medicare and Medicaid, which fall under the National Health Insurance model, and elective surgeries, which fall under out of pocket. The affordable It is important to educate people around the world to know what their country's healthcare system is. You should know what your country's healthcare system is because you need to know if like what kind of insurance you need, or if it's like all through taxes, or if you have to have a job who provides you with insurance. Because if you have no insurance and your government won't provide you with any benefits, you are more than likely not going to be able to afford any of the bills, especially if someone in your family gets really sick. It is important for me as a potential healthcare worker to know what type of healthcare system we have in the US. It would be beneficial for me to know that so I could help my patients with any questions they have and to help them kind of figure out what plan they should take to get the most out of like what they're paying for. I would also need to know this because I am a US citizen and need health care and insurance. So I need to know what would benefit me the most at a good rate. My third and final topic will be women's health. I picked just a few of the women's health presentations that stuck out to me. The first one was gender based violence and the fact that 1 out of 3 women get physically or sexually abused. And then, on average, in the US, once every 20 minutes, a woman is abused by her intimate partner. The next one that really stuck out was female genital cutting. It was something I've never heard of before this, and it's just like really weird and scary to know that 200 million people today around the world have had this happen, and that 500,000 of them have happened in the US. So sex trafficking is something that I've known about for a while, but I never knew that only less than 1% actually come home to reunite with their families, and that is a $32 billion industry. So sexual assault is something that I think a lot of people deal with, and they shouldn't have to. And 68% know their attackers, and then a sexual assault happens once every 98 seconds. It is incredibly important to spread awareness for these women's topics because they're so prevalent in so many areas around the world. The more awareness and education that is spread, the more likely these issues will come to an end, and these issues are not something that we can just turn our backs to. It will not solve itself. It is incredibly important for not only me to know about all the risks for women, but just for everyone to know all of them because this stuff can be prevented if all of us work together to stop it.